10 ways how to control high blood pressure at home. Blood pressure readings in many persons are higher than usual. This could be due to a sedentary lifestyle, heredity, or a side effect of another medical condition. For good reason, hypertension, high blood pressure, is known as the silent killer. It is a substantial risk factor for heart disease and stroke, despite the fact that it generally has no symptoms. These illnesses are among the most common causes of death in the United States. Finding the cause of your elevated blood pressure is the first step toward lowering it. Many people with high blood pressure, on the other hand, don't know why they have it. In this scenario, it's important to see a doctor to find out what kind of lifestyle changes you should make. What should you stay away from if you have high blood pressure? Foods and drinks to avoid if you have high blood pressure. Meat from the deli. Pizza from the freezer. Pickles. Soups from cans. Tomato-based items. Sugar. Foods that have been packaged. Salty foods like smoked fish, century egg, fried pork with a salty taste. Number 1. Increase your activity level and do more exercise. Your heart will become stronger and more efficient as a result of your physical exercise. The pressure on your heart and blood vessels will be reduced as a result of this shift. If you want to lower your blood pressure, you should stay active every day. Your heart becomes stronger and pumps with less effort as you boost your heart and breathing rates on a regular basis. This decreases your blood pressure and relieves pressure on your arteries. The American College of Cardiology, ACC, and the American Heart Association, AHA, recommend 40-minute sessions of moderate to vigorous intensity physical activity 3 to 5 to 6 times a week. Walking, jogging, cycling, swimming, short burst treadmill, yard work, biking, climbing stair or hills, playing tennis or basketball and dancing are just a few types of aerobic exercise that might help decrease blood pressure. You might also attempt high-intensity interval training, which involves alternating brief bursts of intensive exercise with lighter activity recuperation periods. Keep watching and stay with me until the end of this videos. I have some more tips for you to improve and stay healthy of your heart and body. Number 2. If you're overweight, you should lose weight or diet. There are numerous crazy diet suggestions that promise to help you lose weight quickly while also leaving you hungry and deprived. But what good is it to lose weight just to gain it back? It's important to lose weight gently if you want to keep the pounds off in the long run. Many experts, nutritionists, and bodybuilders believe you can achieve this without going on a diet. Instead, simple lifestyle changes are the key. Controlling what you eat on a daily basis is the best method to enhance your health and blood pressure. Food has the ability to improve or aggravate your illness. Potassium-rich leafy greens including kale, turnip greens, spinach, and arugula can help lower sodium levels in the blood, so improving blood pressure regulation. 6 to 12 pound weight loss will help lower your blood pressure. You'll also be less likely to develop other health issues. Number 3. Limit or eliminate drinking alcohol. For people with high blood pressure, cutting back on alcohol consumption is critical. People should drink no more than 14 units of alcohol per week in order to live a healthy lifestyle. 1 measure of liquor, half a pint of regular beer, or half a standard glass of red wine equals 1 unit of alcohol. Making lifestyle adjustments can help you lower your blood pressure, reduce your consumption of booze. Heavy drinking has been linked to a higher risk of hypertension in both men and women, according to study. Or eliminate totally drinking alcohol will give you a chance to reduce blood pressure to maintain to a level of good health. Number 4. Stop or quit smoking. Tobacco's compounds can raise blood pressure over time by causing damage to blood vessel walls, inflammation, and narrowing of arteries. Blood pressure rises as a result of artery hardening. Many disorders, such as hypertension, are linked to smoking. Nicotine can increase blood pressure and heart rate, as well as the risk of blood clots and heart attack or stroke. It can also restrict the arteries and make the walls of the arteries more rigid and less flexible. Although quitting smoking is challenging, it has numerous advantages. Your heart rate and blood pressure should return to normal within half an hour following your final cigarette. That's good news, because high blood pressure is regarded as the silent killer, because its harmful effects often go unnoticed. Number 5. Eat more potassium-rich foods and less sodium. A high salt or sodium diet can increase your risk of heart disease and stroke by raising your blood pressure. Many persons with high blood pressure are unaware of their condition because it often has no symptoms. Read tips for a lower salt diet for ideas on how to cut back on salt. Potassium has a dual benefit. It reduces the effects of salt in your system while also reducing blood vessel stress. Potassium-rich diets, on the other hand, may be detrimental to people who have kidney illness, so consult your doctor before increasing your potassium consumption. Check my other videos about potassium. 25 foods high in potassium to reduce blood pressure. Number 6. Reduce your stress levels. Deep breathing exercises are one of the many different strategies you can employ to relax or lessen tension. Meditation. Meditation that focuses on the present moment. Muscles are gradually relaxed. Relaxation while listening to music. Biofeedback is a type of biofeedback that involves, explained below. Counseling can assist you in recognizing and releasing stress. Number 7. Take a look at herbal remedies. Green tea, black bean, ginger root, turmeric or curcumin, celery juice, sesame oil, garlic are some herbal medicine that you can take. But please do consult your family doctors for right for you. Number 8. Consume dark chocolate. It's difficult not to like this news. It's healthy to eat a tiny, 1.6-ounce dark chocolate bar every day. Epicatechin is abundant in this dark chocolate bar, as it is in other high cocoa content dark chocolate bars. Epicatechin belongs to a class of chemicals known as plant flavonoids, and it's one of the most active. It's quite nutritious to get good dark chocolate with a high cocoa content. It's high in minerals and has a good level of soluble fiber. 11 grams of fiber are contained in a 100-gram bar of dark chocolate with 70 to 85% cocoa. Number 9. Consider reducing your caffeine intake. According to current research, everyday coffee consumption has no effect on blood pressure or total heart disease risk in those with high blood pressure. Coffee may, in fact, be beneficial to your health. Because it is unfiltered and boiled, traditional Greek coffee has more of these compounds than most other forms of coffee. Some advise hypertension patients to drink coffee in moderation, no more than 1 or 2 cups per day, as it appears to improve arterial aging. Number 10. Take your prescribed medication directed. If your blood pressure is more than a little high, your doctor may recommend that you take blood pressure medication. You have organ failure, coronary artery disease, diabetes, or kidney disease, among other health issues. You have 1 or more heart attack or stroke risk factors. Don't skip any medicine prescription because silent killer always wait for you to forget to consume this vital or important maintenance medicine. Keep in mind always or make a table chart when to drink doctor's prescriptions. Changes to your blood pressure medication should not be made on your own. It's vital that you see your doctor. Stopping any drug used to treat high blood pressure suddenly could be extremely harmful. Your blood pressure may rise, increasing your chance of a heart attack, stroke, and other life-threatening diseases. If your blood pressure is 140/90 or greater, stage 2 hypertension, you should consider taking medication. At this point, your doctor is likely to start prescribing medication to lower your blood pressure. At the same time, you'll have to adapt your way of life. It's a medical emergency if your blood pressure is 180/120 or above. I hope you like this video as summarizes some of the necessary remedy to lower the level of high blood pressure. Disclaimer of medical advice, diagnosis, and treatment. This YouTube channel and its services do not represent medical advice, diagnosis, or treatment. For diagnosis and treatment, including your unique medical requirements, always consult your healthcare professional. Please consult a certified healthcare practitioner as soon as possible if you have or believe you have a medical problem. If you enjoy viewing my channel, please subscribe, like, and leave a comment.